and I asked that you share with me if there's this friend, family member, colleague. Well, no, not colleague. Somebody you know who's a health worker that you want us to celebrate. You can just give me a call. Also, there's a WhatsApp on 055 1111997. So today is our day for we the health workers. And of course here on Joy FM, led by Dr. Yaw Osafo, CEO of Medical Hospital Mampo Equipping and Medina Firestone. My colleague, doctor. My brother in service. Dog.
Associate.
My associate
you know.
in the business.
You know. No wonder you're wearing white today. You
Bro.
Know, white.
Yes. You see, I was telling them that I'm a health worker. I heal wounds and pain. And yes, I'm a health worker.
It's true, Kwame. What you do Monday to Friday. And on the weekends.
Look, if I wasn't there,
you do a lot more.
If I wasn't there,
you reduce the numbers.
The number of people who come to your clinic.
Wow, so Kwame, yes, today is our day. Today is our special day, and one warm good afternoon to everybody who is listening right now.
Yeah,
and I'm very happy that we're shining the spotlight on healthcare workers. We didn't used to have this day or this week. It's a whole week, and I didn't know about it until one of my staff, prodded me and said, "Hey, Doc, now when you hit my
health workers week
came in to wish me a happy health workers week." And I was like, "Oh wow, oh finally!" I think that the spotlight is on.
You think that this spotlight actually comes because of probably COVID?
To a large extent,
it has enhanced it. Huh?
I think it crystallized the role played by healthcare workers. The pandemic. I think it's the first in its generation. And the last time there was a pandemic was 1918 or so. So it was the first time many of us got to see the role played by healthcare professionals. And the wide disciplines, different disciplines. But if we would be honest, even with the TV and radio, it's always the politicians, and then if you are not doing politics, then we are doing sports. No, not sports. We are doing football. Joy, they say Joy Sports, but it's always Joy Football.
No. There's some other sports as well.
So they take a lot of the time.
Yeah.
But during the pandemic, for the first time, you guys were talking to different healthcare professionals. I think most people got to know about Noguchi for the first time. KCCR, Kumasi Center for Collaborative Research.
Yeah.
But didn't even know that some place like that existed. You were speaking to vaccine professionals, you were speaking to microbiologists, and all sorts. And people became experts with medical terms.
Yeah.
But the pandemic also had a very, very dark side to it. The death toll was immense. Fortunately, we were spared that level of mortality. But I remember in northern Italy, every day you turn on the news or the TV channels, and 600 people dying every day.
Yes.
And they were just laying the coffins there.
Yeah.
In India, they didn't have enough firewood for the pyres that they would set for cremation, and they'd run out of firewood. In New York, they had to commandeer meat vans to be using as storage, temporary morgue facilities. The impact it had on healthcare professionals, a lot of them, the mental health.
Yes.
And then for the first time, I think a lot of us also got to realize how dangerous our work really is. When everybody was staying away, you've got to go and treat people who had a very, very dangerous and potentially deadly medical condition. You had to be very close. So there are certain parts of the world right now where healthcare workers have decided not to go back. Too many of them have been traumatized. You're not getting young people in college or high school saying that, oh, you know what, I want to be a nurse. I want to be a doctor. I want to be an infectious disease physician, so on and so forth. Most people have decided that, well, let me do let me take on another profession, a safer profession. So I think now we all have a deep sense of appreciation. Look, before COVID, especially in our part of the world, healthcare workers across board, starting from doctors to nurses, pharmacists, great respect. It's one of the most respectable professions if you are in the healthcare profession. So yeah, the respect has always been there. We've always enjoyed it. It's a given that if you're a healthcare professional.
But you think now people are shunning away from it?
In those places where they bore the brunt of COVID, in our part of the world, we didn't really see too much of it. Yes, it was just a lot of the public health angle. I think Africa in general, we didn't suffer it that. I think South Africa was the one that really got hit. But beyond that, we didn't get anything like what was happening in Italy, what was happening in Great Britain, what was happening in the United States, Brazil. Oh no, we didn't have anything like that. But even Kwame Kakrana, tidbits, the little that we saw. Yes, it was challenging, and we've got to see how healthcare professionals use minimal resources, for maximum gain. And I think also some of the steps taken at the time, by the government, also helped us a lot. So we didn't, have the full effect. It also exposed our healthcare system, the inadequacies.
Yes.
We didn't have infectious disease hospitals that are sort of like dedicated to that. We built one in record time. During the pandemic. We need more. I mean, I think through that we had this agenda 118 or something coming up, because we realized that a lot of our hospitals were inadequate, but the numbers also came to the fore. Look, if you look at our doctor-patient ratio, you look at our nurse-patient ratio, it's atrocious. The WHO, I think, recommends about 1 to 10,000, or is it doctors, one doctor to about 10,000 or so, or is it 7,500? I'm not so sure, but we're nowhere near that in most parts of the country. You have 1 to 20,000 and all of that. For the nurses, it's even much more acute, because you are looking at 1 to about 450, one nurse to about 450, and we're nowhere near that. Those numbers. And I think we need to, if we have this week, we need to celebrate those who are here and throw more light on it. But Kwame, there's also...
What's interesting for me, though, is the fact that there's so many different professionals in the health sector. So we're talking doctors, we're talking nurses and all, but there are so many others as well.
Exactly.
The radiologists. We have radiologists. We have... who again do we have? Tell us.
We have even some strange names. So that's what I was going to do today. I was like, I wasn't going to talk about the regular things. I was just going to spend a few minutes just to highlight probably some names and some professionals that you've never heard about. Well, I mean, a lot of people, let me start with this. This one is simple, but then I think a lot of people still miss it. A lot of pregnant women come to the hospital and say, I'm coming to the gynae. I'm coming to see the gynae. But do you know that the full name is an obstetrician gynecologist? OBGYN for short. So he's an obstetrician and then he's a gynecologist. So it's two disciplines put together. But most people just say gynecologist. But the obstetrician is a doctor who takes care of pregnant women.
And the gynecologist?
And the gynecologist is a doctor who takes care of diseases that affect the female reproductive system. So he or she typically would have a lot of non-pregnant females. Well, by the pregnant females who may have some medical challenges, then they are seen by the obstetrician. So when you're going for the antenatal, for example, the doctor there, it's working as an obstetrician, and not as a gynecologist at the time. Right, although there's an overlap, when we work, so we let it slide. Right. I also want to talk to you about a podiatrist.
Why?
Grab it. So I'll let you know about. That's it.
A podiatrist near Obi Didi or airport. And then you did it.
Right. So there are some healthcare professionals who just specialize in taking care of your feet.
Okay.
Look, we take our feet for granted. But Kwame, one of the key things that makes us different from all other organisms, if I'm allowed to put it that way, is our ability to move. Mobility. If you can't move, you see, in 2020 when the president said everybody should stay at home, 3 weeks back, it's part of the way we live, that we have to be mobile, we have to move, and your feet carry you around. And therefore, there are so many medical conditions that affect your feet. And there are some healthcare professionals, that's all that they do.
I see. They call it a podiatrist.
Yes. They will smell your feet. Because your feet can sometimes give off certain odor that can lead to certain diagnosis.
The foot rots and whatnot.
Exactly. I know they are now. Right. Diabetics. When people have diabetes mellitus, and unfortunately they develop very terrible ulcers on their feet, sometimes we have to do some level of amputation, amputate some of the toes and things like that. Then you have to involve them, because in designing footwear, appropriate footwear, so they are very, very, very important professionals that help the orthopedic surgeons and their clinics. They help diabetologists run their clinics, and many others, children when they are growing, and people want to have the ability to do a catwalk and all of that. So gait issues and all of that. So very, very important. Right. I also want to talk about the physiotherapists.
Okay.
More often than not, the moment you mention physiotherapists, people think about massage for no. Oh no. All right, at least these days with sport and the way football has become such a global thing, and we all have access to it, whether or not you have DSTV in your home, you can just walk to the nearby. And during games, we see sports medicine professionals, attend to patients, players rather, who are badly injured. Well, at that time they are patients, badly injured, and they even sometimes give them some level of anesthesia on the pitch. They make sure if they have a fractured limb, they would align it, protect it, and carry them off. So the physiotherapist is also a healthcare professional whose focus is on, again, proper movement, development of mobility, and restoration. Anytime you are injured, you injure a muscle, you injure a nerve, you injure your bone, well, then the physiotherapist is going to help you get back to your pre-injured state.
Right.
So anytime we think about, a part of my body hurts and I can't move it, you probably would need the help of a physiotherapist.
Okay.
They do a lot of anatomy, they study the structure of the body, the various muscles, and they can bring you back to health.
Since you mentioned that, let me just send a special regards going out to the doctor for the Black Stars, who's a very learned man in the business, Dr. Prince Pambo.
Right.
And his team, who have been taking care of the Black Stars players as well. So regards to you, Dr. Prince Pambo is a great professional as well.
Right.
Yeah.
We love our players. When we hear that, Partey is not playing the next game, then everybody is anxious. They get them back, when even they get injuries. So they are another group. They do very, very good work. We all like to smile, right?
Right.
Show our teeth,
the dentist.
Right, so the dentist. But I think everybody knows the dentist, but we know the different groupings when it comes to dentists. So we have the orthodontists.
Okay.
Orthodontists. So they're the ones who look at the alignment of your teeth.
Oh, I see.
Right. The alignment of your teeth. So it's very, very important. And sometimes in Ghana, not in Ghana, but all over, you find people with different kinds of problems with regards the alignment of the teeth.
Right.
And sometimes you have to need braces.
So it means Dr. Edem Siale is an orthodontist, because he's the one I went to see, and he gave me the braces.
Right.
You know, I'm wearing braces, right?
Yes.
Yeah.
So the alignment, when you have problems with the alignment of your teeth, you know, the way they erupt.
Okay.
So one is in front of the other, and it makes or it gives you great difficulty in chewing and all of that. So sometimes there's a functionality. It's not just the cosmetics.
Yeah.
You know, functionality of it. So yes, the orthodontist, that's what they do. Then you have the periodontist. And this is a dentist who has special interest in gum disease.
Oh, right.
So in Ghana, we have this misconception that when you grow old, your teeth should fall out.
Yeah.
But it's
supposed to be intact.
You should die with your 32.
Ah.
So that the archaeologists 500 years down the line, they can study it. You know, when we dig up, you know, the archaeologists right now, they study, you know, the teeth for people who died 3,000 years ago.
Wow.
Right. Then there's also the anesthetist. Anesthetist. Well, let me make it simple. The people who put you to sleep.
I know one.
Before we cut. Sir.
Yeah. Should I mention? Should I mention her name?
Mention her name.
The one and only Augusta, our boss Bakope, Mrs.
Yes.
Mrs. Osafo.
Yes.
So she's an anesthetist.
Yes. So anesthetist, anesthesiologist, and they had different cadres. They have the doctor anesthetist, they have the non-doctor anesthetist as well.
Okay.
But they want to put you to sleep. The whole thing is that we don't want you to feel pain.
Yeah.
When we cut.
I see. Has she tried it on you?
A few times I've been threats. But that I wasn't in the medical environment. So
okay.
I learned to not to be too, you know.
Now you know who your boss is.
Oh yeah, Baba Wanda. Sorry.
No,
you and St. Peter are having conversations where you don't want to. Right. So I think they play a very important role. For a long time, we perform very, very difficult procedures like amputations without anesthesia. But now all of those things, reducing fractures, you know, you break an arm and we want to reduce it and put a POP there, we can give you something. They can also numb parts of your body so that you are still awake, and then we are able to do that. Okay,
let me activate the phone lines now so that our friends can call. If you know any health worker that you think deserves a bit of
fans.
Fans. Okay. Some recognition. Please call us and appreciate them for their work. Okay. 0302216541. A lot of messages have come through.
Oh, okay.
Go ahead. You were saying
but I was just going to ask you whether you've had any memorable experience with a healthcare worker. I'll share mine. In 2006, I was playing football and I broke my right leg.
You did?
In 3 different places.
Wow.
It was such a horrible injury.
I don't know that descend elbow banana.
It's Kebia Sunimu. It's Kebia. And I had just a very bad injury, tackle, and I broke my leg. You see, that brought me into contact with my colleagues, my senior colleagues for the first time. And oh my goodness, man, who told me, and I was like, wow. You know, so although I was in there, I knew what we do in the field. You know, when I experienced them that way, fixing me, putting metals in my leg, and all of that, and I could walk again. You know, I was like, wow. And I'm always thankful to Mr. Holbrook Smith. He used to be former chief executive of Kolebu Teaching Hospital. He was the head of the team. He's an orthopedic surgeon, and they put me back together. And,
awesome.
And I'm very, very grateful to them.
All right, let's see who's here. Hello.
Hello.
Hi, you're welcome.
Lexis, hi.
How are you?
I'm good, and you?
I'm very well, thank you. What's your name?
My name is Dolly.
All right, Dolly. Dolly, let's hear you.
I want to give a big shout out to all the doctors at Trust Hospital.
Right.
They've been doing wonderfully well for all of us. Last
Trust
year by this
Hospital
time I was sick, but they took good care of me. After birth, I had some complications, and they were good to the staff, and by God's grace, I'm here calling you today.
Oh,
Trust Hospital, God bless you.
awesome. God bless you, Dolly. We are happy you're here with us as well. Thank you so much for calling. Yeah. All right, and I need to agree that the Trust Hospital doctors are also very good as well. Yeah, so Trust Hospital, the team in Osu, we say bless you. Right, 0302216541. I want to give Dr. Kaba of Ridge Hospital a shout out. He has a lot of patience for his patients.
Right.
In fact, he needs an award. AC from Tema. All right, AC. Thank you very much.
Right.
All right. Hello.
Hello.
Yes, welcome, sir. What's your name?
This is Nicholas from New Ningo.
All right, Nicholas, let's hear you.
Yes, one of my friends, he's called Resford Kachepo, St. Joseph Hospital in Kwanta. He's one of the anesthetists over there. I don't know if I've mentioned the word well, please.
Oh, yes, you're spot on.
Yeah, you got that.
He's one of the best guys. The first time I entered the theater, I nearly went off because of him. He made me to see how surgery is done. And I witnessed 2 surgeries. It was not easy. It got to a time I felt pain in my chest. And the doctor said, hey, where you have gotten to, go and lie down. Not knowing I was going off. So Rexford and the colleagues, he even graduated from Cape just this Saturday. He has gone to school and come back again. Rexford, he has been very good.
Nice.
I want to mention him and praise him for what he's doing at Nkwanta South.
Awesome. Thank you so much. That's really good. I like that. I like that. Abba says a shout out to Dr. Osafo himself and all the health workers at Medicas Mampong. Yeah, Doc, you guys are great. You guys are great. And let me see. One from Noguchi. Did you get? Okay. Shout out to my wife and CEO Irabna Oduma Duka of Noguchi Memorial Hospital, the virology department from Kweku in Lakeside.
Right.
Okay. And we need to also celebrate our clinical psychologists who have been helping us as well. That's also another group of health workers, very important group of health workers. Notedia and his crew.
They are doing his crew. Yeah. Yes. Even this afternoon, I think I heard he was in on a program.
Yeah.
Yes. Clinical psychologists, and what they do is that they are involved in mental health, and typically they do what we call talk therapy.
Yeah.
You know, and it's a great job they're able to do. So they are very, very important mental health professionals. The difference between them and then the psychiatrists is that in most places they don't use medicines, but then they do what we call the talk therapy in helping to diagnose and then also manage different mental health conditions.
Okay.
Joy.
Hello.
Hello, good afternoon.
Good afternoon, brother. What's your name?
I'm Kofi Kata from Sogakope.
All right, Kofi, let's hear you.
Dr. Joseph Kopisa at St. Joseph's Hospital at Joje. He's doing great in the Volta region.
Is he the orthopedic surgeon?
Yes.
Oh, okay.
He's one of the best, let me say, in the country.
Awesome. God bless him.
He's wonderful.
God bless him.
Absolutely,
Thank you so much.
Yes, I know him.
You know him,
yeah, fantastic guy, and he's doing great as well.
Let's celebrate our pharmacists as well. Great pharmacists who have been very busy.
Exactly.
Getting us the right drugs for our ailments.
So when it comes to pharmacy, I think everybody knows that we really, really appreciate that. The community pharmacy. Most people will just walk in, you know, and get the drug. But do you ever spend any time to think about drug development, the R&D that goes into it to make sure that we get the right, whether it's a drug, whether it's a vaccine, they are really, really at the forefront of healthcare delivery. And the pharmacists are sort of like everybody's backyard. Everybody knows, you know, I can go in and then get them.
Yeah.
But I think there's one.
Mr. Sam Donko, great pharmacist. God bless you, Sam Donko. We're grateful. Let me send regards to Dr. Grace Bachman, MD of Sunotech Medical Center as well.
Yes.
Doc, you're saying?
Yes, I was saying that when it comes to the community pharmacy or the pharmacy.
No, you actually were referring to a message here.
Oh, yes. I think you read that. Dr. Grace Bachman,
right,
the MD of Sunotech Medical Center. Yes. Fantastic doctor.
0302216541. Do we have somebody on the phone? Hello?
Hello, Lexis.
Yes, sir. How are you, brother?
I'm fine. This is Big Ginelli calling all the way from Pristia.
Oh, wow,
Yes,
brother. It's
very
good
good.
to have you back on here, man. How you doing, bro? How you doing?
Fun. It's always fun talking to you.
Awesome. Talk to me, man.
I have this doctor friend of mine, Dr. Matthew Aka. He's actually at Kumasi Nishia Hospital. Lexis, you have no idea how this guy has been good. So I just want to thank him for his service to Mother Ghana, to myself, to everyone. He's actually a pharmacist and a doctor. So I want to take this day to appreciate him and thank him for his service.
Right.
And you know one thing, if you have a doctor friend who is that close, Charlie, it's something nice though. Sometimes you don't stress. I can call doctor on video. Doctor, this is my problem. You just speak to me. Are you feeling this? Are you feeling that? Okay. And then, you just give me some prescription. At times, when he's free, you just pass by and then check up on me, and then I'm good to go. So,
Wow.
Charlie, it's a great feeling. And I also want to thank Dr. Osafo for always being available and then teaching us stuff.
You're welcome.
Thank you so much, brother. And yes, Doc, we celebrate you.
Thank you.
You would have to still leave us with your number because we will need you again.
Absolutely.
For those who want to get in touch with you, Doc.
Right. So it's 0501 477 340. So the entire team at Medicas Hospital, if you want to reach us, is 0501 477 340.